Hello and welcome to my video presentation. In this video, we will be talking about adapalene and explore its pharmacokinetics and its mechanism of action, as well as its adverse effects. Let's get started. First, let's have a clear understanding of what adapalene is. Adapalene belongs to the class of retinoids. Retinoids comprise a family of compounds with structures and mechanisms of action that resembles those of vitamin A or retinol. And as we all know, vitamin A plays a huge role in cell growth and differentiation. Adapalene is an FDA-approved topical retinoid, which is used for treating skin condition called acne vulgaris. Adapalene usually binds to the receptors called retinoic acid receptors, or RAR in short. It is also known for its anti-inflammatory, anti-proliferation, and immunomodulatory effects on comedones. Comedones are the skin-colored small bumps usually found on forehead and chin of people with acne. Examples of this are blackheads and whiteheads. Furthermore, despite its usual main indication as treatment for acne vulgaris, recent studies actually suggest that it is also effective in treating a wide range of dermatological diseases and can even potentially reduce the risk of cancer. Now let's get into pharmacokinetics of adapalene. Adapalene is topically applied and its absorption occurs through the skin. According to a clinical research, 16 individuals with acne condition were subjected to be treated with 2 grams of 0.3 different gel of adapalene by applying to 2 milligrams per centimeter squared of their skin. 15 patients had detectable blood plasma adapalene levels, 0.1 nanograms per milliliters, resulting in mean Cmax of 0.533 plus or minus 0.466 nanograms per milliliters and the mean AUC or area under curve of 8.87 plus or minus 8.46 nanograms per milliliters on day 10. Drug molecules of adapalene are distributed in the epidermis and dermis. A liberation and penetration study suggests that in 0.1% of gel applied in the skin, only 0.01% was able to penetrate the skin. In regards to its metabolism, it is generally known that adapalene accumulate in the liver and gastrointestinal tract. However, further knowledge regarding its metabolization in human body is currently unavailable. Approximately 25% are metabolized, and the majority is excreted as parent drug. The main route of elimination for adapalene is through the biliary route at about 30 nanograms per grams of the topically applied amount. An approximate of 75% of drug will remain in its original form. The terminal half-life was between 7 and 51 hours. Let's move on to its pharmacodynamics. Adapalene works by binding itself to retinoic acid receptor beta and retinoic acid receptor gamma. It then switches bits and pieces of DNA called retinoic acid response element, or RARE for short. After that, it triggers gene transcription, which then leads to proliferation and differentiation of keratinocytes or keratin cells. Consequently, it decreases microcomedone formations, exfoliates mature comedones, and provides anti-inflammatory effects. According to Australian Medicine's Handbook, adapalene can also cause adverse physiological effects. This includes itchy dry skin and irritation, burning sensation, hypersensitivity reactions, blisters, phototoxicity, edema, erythema, and pigmentation changes. Adapalene does mostly fall under Schedule 4 prescription-only medicine. However, topical preparations that have zero point 0.1 or less adapalene in them can fall under Schedule 3 pharmacist-only medicine. Prescribers of this medication include doctors, nurse practitioners, and midwives. Despite its minimal absorption through skin, Several harmful physiological effects are still associated with it. Consequently, provision of knowledge regarding its proper use is vital. Now, in counseling, in administering adapalene, it should only be applied once daily, either morning or nighttime. Possible effects: adapalene could potentially induce skin irritation such as redness, stinging, and peeling during its early stages of usage. If irritation is troublesome, decrease the frequency of application or take a rest from the treatment. If irritation persists and continues to escalate, end the treatment and consult your doctor.